link.
Did the microphone sound good?
Perfect.
Okay.
Okay. We'll wait a few more minutes, Dr. Jyoti, before we begin. We're still a little early, so. We're still a little early, so. Assalamu alaikum, everyone. Thank you so much for joining today's session. Today's session we're hosting a virtual discussion on how parents can help manage the health and well-being of their children during the crisis with our own Dr. Hassan Chaudhry. Dr. Chaudhry has been a well-known pediatrician here in our South Florida area. He has been working in FACey and also is affiliated with Henry Mayo and also Providence Holy Cross. Assalamu alaikum, Dr. Chaudhry. I'll let you go ahead and give a proper introduction to yourself, if you don't mind. And just before we begin, for the folks on the call, if you can please keep yourself on mute. And if you have any questions, please feel free to leverage the chat functionality in the Zoom Zoom tool. And the process is going to, Dr. Chaudhry will provide his speech, and after his talk, we will open it up for Q&A. Dr. Chaudhry, over to you, sir.
Thank you. Assalamu alaikum wa rahmatullahi wa barakatuhu. Ashhadu an la ilaha illallah wahdahu la sharika lahu wa ashhadu anna Muhammadan abduhu wa rasuluhu. Assalamu alaikum, dear brothers and sisters.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
We are afflicted by the novel coronavirus recently that is affecting billions of people around the globe. Without talking about this pandemic, I would like to focus on our main topic today, that is health and well-being of our school-aged children and how we can help them during this crisis. I would like to touch base few important points that could help us guide our children over the next couple of months. I would start with health maintenance. So how we can keep them healthy. The two most important things during this time would be very important that our children are not going out. If they go out, maybe maximum to the backyard or so. They have to avoid contacts with their friends now because we don't know who is infected, who is carrying the virus. Second important thing would be hand washing. It's very important they wash their hands on a regular basis. Anytime they touch any object, any surface, they have to wash their hands. The rule is for washing hands is you have to wash with soap and water for at least 20 seconds. Or we always tell the kids, in order to count 20 seconds, they can sing Happy Birthday song twice. So that would be around 20-25 seconds. Good nutrition is very important. They have to eat regularly their meals. They have to eat proteins in their diet. They have to eat vegetables and fruits. Lots of vegetables and fruits have antioxidants and vitamin A, C, E. These are the good antioxidants that actually help our immune system more stronger. Besides the antioxidants, zinc is also very important. Avoid outside foods as much as possible during this time because the foods could be contaminated. Even if you order some foods from outside, the boxes could be contaminated and kids and adults, anyone can get sick from that. One of the most important things to keep in mind is that our routines have to be kept in place. It's good to set a regular schedule and stick to it. Going to bed, waking up, and eating meals at normal time as much as possible. The schedule can mimic a regular school day or a day camp or daycare schedule. Now, instead of school, parents can set the schedule for their children. One of the most important thing is anxiety. You know, during these kind of situations, people are anxious. Parents are anxious, we are anxious. So it is obvious that everybody is anxious due to the COVID situation. Remember, our anxiety could have a huge impact on our children. We need to keep a sense of perspective and engage ourselves in solution-based thinking. watching TV, watching news, reading articles about the coronavirus crisis could be sometimes detrimental. Sometimes friends send some confusing posts about COVID-19 that makes very little sense. People are getting messages through Facebook, Viber, WhatsApp. But before you accept the messages, you make sure that when you read the messages, you think about what the health professionals are saying about this, what are the scientists are telling about this virus and about this epidemic. So we need to have our own filtration system to ignore useless informations. We need to keep in touch with our healthcare providers in regards to any COVID-related questions or concerns. Next one is we need to talk to our children in a clear and reasonable way what's going on currently. But remember, kids don't need to know every little thing unless they ask specific questions. Keeping it positive. Some young kids may look happy as they don't have to wake up early morning to go to school. So others, especially the older kids, may be sad because they are not being able to go to school and interacting with their friends. But we can tell our kids that it's cool to have whole family at home together and having great time together. Remember, we still have to do our work and stick to a regular daily schedule. For the family, staying together is now a blessing in disguise. How about little kids? You know, the young kids may feel unsettled by the changes in their routines and worried about the surroundings as adults look upset about the coronavirus crisis. If anyone is having tantrums, I mean, any small kids having tantrums more than usual, they're acting out or being defiant, maybe having some anxiety. We can talk to them during a calm, undistracted time and ask about their feelings and responding in a calm and comforting way that may actually be helpful. Electronics. During this time of crisis, kids will be using electronics little more than usual. This is partly because their schoolwork, their homework, they're all done through computer use. And also they're bored at home for obvious reasons. So we can forgive ourselves for not being the perfect parents by allowing them to use TV, computer, iPads, etc., little more than usual. But it doesn't mean that they can stay on the electronics throughout the day. We can allow ourselves to relax these boundaries a little bit now, but we need to explain to our kids that this is a unique situation and we have to reinstitute boundaries when life returns to normal. Stay in touch virtually. We can let our kids use social media within reason and Skype or FaceTime to stay connected to peers, even if they're not normally allowed to do so. This can help them feel less lonely and reduce stress from being away from their friends. They can also connect with their relatives via electronics. As Muslim families, we have to tell our kids that they can read a couple of verses from the Holy Quran daily with understanding their meaning. They may listen to some good lectures given by reputable Islamic scholars. Now we have more opportunities for doing things together and sharing responsibilities at home. Even children can do things based on their age. Toddlers can learn to pick up their own toys. Older children can watch their younger siblings if needed when both parents are busy. Most children can set the dining table Older children can wash dishes, sometimes make breakfast for themselves and family, organize their rooms, and do laundry. Working as a team will help the family feel much better. It's harder for the kids who do play sports. Introduction of certain daily exercises at home may also be very important. We can be creative and flexible. We need to find a balanced schedule that works best for our family. We can play board games or card games together. Going out to the backyard in the fresh air would be also helpful. The most important goal during this time is to stay safe and at the same time, reduce the stress as much as possible. I think I will stop here and I will take questions and we'll try to answer your questions.
Thank you so much, Dr. Chaudhary. Really appreciate it.
You're welcome.
Great, thank you.
Either raise your hand or put it through the chat function, please.
Okay. Can you do some stuff I'm trying to?
Is it muted or unmuted?
There we go. Anybody have any questions?
Nobody?
All right. So, Doctor, I have a question actually that might get people thinking. For kids who are in elementary, for them, as you said in your talk, that it's difficult to kind of keep them engaged or get them active outside, because most of these kids are used to being out and about. What's your recommendation in keeping them being able to get more activity aside from just being at home because of this of the virus we have currently? Doctor, you're not, can you unmute yourself? I think you're trying to talk on mute.
Okay. You have to tap. You can tap on. Can someone tell him what to do?
Chaudhary, if you can unmute yourself.
I don't think he knows how.
Okay, can you hear me now?
There you go, yeah, we can hear you now.
Okay, so answering to your question, they can go to backyard or outside the house as long as they're not in close contact with someone. They can go, they can ride bike, they can ride a scooter, they can run around outside throwing a ball, catching a ball. So I would recommend, if you have any basketball hoop or anything like that, they can play basketball. If you have some space around your house, definitely they can go play soccer or running around. These are the activities I would recommend outside. Besides that, inside also, they can do some push-ups, sit-ups, they can play with their toys, they can run around inside the house, these are the things I would recommend during this time.
Okay, thank you, sir, for that. But some of us work from home also, and then sometimes having them run around the house while working tends to be a little disturbing for us. So I was just curious if there's any other, because a lot of times these kids get bored at home also, because they don't get a chance to meet with their friends, interact with other kids, and they'll be sitting watching TV or not really spending time outside in the backyard.
Yeah, depending on the age of the children, you
Right.
can do a lot of stuff, like you can give them age appropriate toys to play with. You can give some color books to color the books, color the pictures. So it all depends on the age of the children. You can help them, practice writing or doing solve a math problem. So it all depends on the age of the child. If it is older child who can write a small story, tell them to write a story, or sometimes we can let them watch some movies or some learning stuff in the YouTube or so.
Thank you, Dr. Chaudhary.
You're welcome.
Assalamualaikum, Dr. Chaudhary. This is Salman. I have a question for you.
Walaikum assalam.
Thank you for doing this, by the way. This is super helpful. How do you answer the question to teens and little kids when they ask this question as to how long will this continue? Obviously, we don't know as of now, as adults as well. There's uncertainty out there. But how do you address that with kids?
Okay, so we have to tell them the truth, what's the situation now. At the same time, we have to make sure that they don't get scared. So currently what we can see that probably is the situation is plateauing, the infection rate is plateauing. So probably in the next month, it will decrease significantly. And hopefully in 2.5 months, socialization would be more reasonable, but it is very difficult to predict since this virus we have been seeing for the first time. So there will be a lot of ups and downs and different type of behavior of the virus that would dictate actually when it's going to end. So you just tell them that we don't know when it's going to end, but it looks like probably in the next couple of weeks, we'll see some improvement. Excuse me. Did it answer your question or? Hello?
Someone?
Dr. Another question came on from the chat. The question is that what should be the recommendation for the sleep routine for teenagers?
Very good question. So I would say like during this time, they might go to bed a little late than usual. That's permissible, but we should not go beyond the routine. So to some degree, they can go to bed a little late and wake up a little late, but it's not supposed to be like several hours late.
Thank you, sir.
No problem.
Another question came in the chat. With allergy season is full swing and not wanting to medicate, what a good recommendation for home remedies?
For home remedies, I would say the best would be like ginger, cinnamon, cloves. These are the good ones to use not only for allergies, it's for any other like a cold symptoms also. So these are the things that has antioxidant, especially ginger has antioxidant that can help your immune system to get stronger. Other than that, if you don't want to use any medication for allergy, honey is one of the good things to use. Pure organic honey.
Okay, thank you. Anyone else have any additional questions for Dr. Chaudhary? A good opportunity to ask it here. All right, Dr. Chaudhary, I don't think anybody has any other questions at this time, but I'm sure if, oh, here's one more question. Recommendation on screen time for teens. What are your recommendations for that?
Screen time.
Yes.
Are you asking specifically the like
teenagers,
amount
I
of
believe.
time? The amount of
Yes.
time?
It seems like it, yes.
So amount of time is very difficult to set. It all depends on like if they have to do some schoolwork, homework, you have to count them also. So besides their school and homework, I would say like the normal time, usually when we don't have this kind of situation, I would say weekdays 30 to 60 minutes a day, and weekends usually up to 2 hours. So now probably I would say like between 1 and 2 hours should be reasonable.
Okay, thank you. I see, Salman, you have a question. I see your hand is up. Is that still a question, Salman, you have? Or an old one?
I think there is another question there in the
Another
box.
question, yes.
Other than
Another question is, what is your recommendation for a dietary plan while staying at home?
Regarding diet, as I told you earlier in the talk, that most important thing is that we have to eat balanced diet. So make sure that we are eating enough proteins, vegetables, fruits, mostly yellow and green vegetables would be very, very helpful. The foods that have more antioxidant, such as eggs, meat, fish, these are very, very good. Fruits and vegetables definitely are good. Besides that, if you want to take some extra vitamins, you can have some multivitamin with zinc and magnesium. Those would be really good as well.
Okay, thank you, sir. All right. Anybody else have any other questions? Okay, another one, thank you. All right, let me unmute. Hold on a second.
Assalamualaikum.
Walaikum assalam.
I have a question regarding the dietary plan. I personally, I do a lot of weightlifting and running and a lot of workouts in general. So do you think there would be a different dietary plan since I'm burning a lot more calories and like others?
Yeah, so if you're burning more calories, you have to take extra calories as well
Okay.
to make up for that.
All right.
Sure.
All right, folks, anybody else have any other questions?
No. ঠান্ডা ফ্রিজে ভাত না
All right. Well, if that's the case, guys, folks, thank you so much. Mehmood, do you have any other things you'd like to add?
No, Dr. Chaudhary, I have I just received one quick question via text. The question here is asking, what is the typical physical activities that the kids should do? Because a lot of kids are staying home and they're not necessarily going out. And so the parent is asking, what should be the typical amount of physical activity? What kind of physical activities do you recommend that the kids do? I think he's okay.
I think he's mute. Let me try to unmute Dr. Chaudhary. Dr. Chaudhary, I think you're mute again. There you go. Yeah, there you go.
Oh, you're
So between 45 and 60 minutes of daily physical activity is important. Now, if the physical activity is vigorous, then 45 to 60 minutes of vigorous physical activity at least 5 days a week. During this time, I think we should do at least 1 hour of activities, at least about, I would say 4 to 5 times a week. If somebody can do like 30 to 40 minutes vigorous activities every day for 1 week, every day of the week, that should be also beneficial.
And this physical activity can be, what kind of physical activities? I think the questionnaire asked, what kind of
Yes,
physical activities? Is it outside physical activities, walking, or? 'cause we
okay,
can-
so outside activity, I would recommend running, jogging, and brisk walking. So not like a slow walking. And also kids can play outside. I mean, if they go out and they play basketball, I mean, just by themselves, like, using a basketball hoop, they can throw the basketball, run around the basketball hoop. That should be also considered as good physical activities. Besides that, they can do inside activities like push-ups, sit-ups, and they can, like, older kids, they can lift some weightlifting. If somebody has stationary bikes, they can do biking also, indoor biking.
Okay, thank you.
You're welcome.
Dr. Diltri, is there a fee or a distance if we're doing the activities outside, running, jogging, and such, walking, briskly walking, and there are other people on the street? Is there something that we should be careful in how our distance, and should we wear masks when we do those activities? I'm hearing different things on those.
Yes, definitely. So you should not go to a place running or jogging where you have a chance to expose yourself to someone. You should be at least, I would say, like, although the rule is 6 feet, I would stay away probably from 8 to 10 feet away from anyone who is running or jogging. Try to run or jog in a place where other people are not doing so.
Okay. And should we wear masks as we jog or run, or that's not needed?
That's a very good question. I would definitely recommend using a mask because you never know, who is going to run in the same place.
Okay. Thank you for that.
Anyway, lately, like, using mask in any social area is extremely important.
Right. Okay, thank you, sir. Any other questions? Okay. Okay. Dr. Joy, thank you so much for your time. Really appreciate it. And I'm sure people can reach out to you if they have any additional questions. Thank you all for taking the time.
You are very welcome. Thank you for having me. Jazakallah khair.
Thank you.
Walaikum assalam.
Thank you. Assalamu alaikum.
Walaikum assalam.